How do we prevent patients from getting infections in hospitals? I'm Heather Loveday and I'm Professor of Evidence-Based Healthcare at the University of West London. The Richard Wells Research Centre, it's one of the only research centres in the country that focuses on infection prevention and control from a nursing perspective. Healthcare-associated infections are any infections that arise or are acquired while someone is in hospital or in another healthcare settings. They are related to having invasive devices, things like drips or urinary catheters. They also include surgical site infections, pneumonias that might happen because you've been in hospital for a long time. Infection prevention is important for three reasons. The first is that if a person acquires a healthcare infection, they often have to stay in hospital longer, they're sicker, and they might have long-term effects of the infection. The second is that healthcare infections are costly. It means we have to keep people in hospital for longer. It means they use resources in a way that we might not other have to deploy them. The third reason is that we're trying to prevent antimicrobial resistance, and healthcare infections use up antibiotics in a way that is not helpful in those circumstances. The process of developing guidelines is something that is fairly rigorous. The process is to ask the right questions, to then involve all the stakeholders, ensuring that those are the questions they want answered. And that includes patients and service users, as well as microbiologists, infection control nurses, and perhaps hospital managers. And then to have a very systematic way of identifying the research, appraising it, synthesising that, and then testing that answer out so that what you produce as a guideline is not just research-based, but it's context-sensitive. And those guidelines were all commissioned by the Department of Health for use in the NHS in England. Guidelines aren't just there as a sort of an encyclopedia of what to do. They also help to drive the action if things aren't going the way they should do. The EPIC guidelines are the national guidelines for preventing healthcare infection in acute care settings. So the key element of preventing infection, if you like, the most important thing we can do is think about the people we care for and not cutting corners so that infection can actually be transmitted.